If you are fully vaccinated, the CDC now says that you can, in fact, be outside without a mask. But some are still wondering, should precautions be taken?
Dr. Leo Lee is an infectious disease specialist with Beverly Hospital, and he's here now to talk with us about that and all the COVID hot topics. Thanks, Dr. Lee, for joining us. Now, what is your reaction to the CDC announcement this week when it comes to masks? Do fully vaccinated people still need to be careful?
Good morning. Thank you for having me. Yes, actually, it was great. They finally came out with recommendations. That's been a big question for a lot of individuals who are fully vaccinated, wanting to know if they still need masks. Now, I should start by saying that the vaccines, as we know at this point, are very effective in terms of decreasing the risk for infection, developing serious infection, and hospitalization. But we also know that the vaccines are very helpful in terms of preventing asymptomatic infection and transmission of the infection. So for individuals now who are fully vaccinated, and that means that they are 2 weeks or more out from their second dose of either the Moderna or the Pfizer vaccine, or 2 weeks out from their single shot of the Johnson & Johnson vaccine, they can actually go out. The CDC actually came up with a chart, and then they looked at activities, what they rated as safest, down to less safe and least safe. And for vaccinated individuals, for those who are fully vaccinated, they can actually go out and not wear a mask. And so the only situation where they might need to wear a mask, or they recommend, is if they're in a large setting, such as a concert, sporting event, parade, or rallies. That's the only time they need to wear a mask. Otherwise, they can be outside and it's considered safe. Other situations, if they're indoors, for fully vaccinated individuals, they do recommend wearing a mask in public settings where they're indoors. For private settings, say small gatherings with family members, they can actually would not wear a mask and not social distance. Now, for unvaccinated individuals, there are certainly much more restrictions. Unvaccinated individuals may actually go out in public, in the outdoor setting, with their family members, and also with small groups of fully vaccinated individuals. But that's the only situation where they can go unmasked. All other situations are really considered less safe or the least safe. And in those situations, they should continue wearing masks both out in public, in the open, but also indoors. It's important to remember that as you increase the number of people you come across, there's also a higher risk of coming across unvaccinated individuals and becoming sick from that, and also passing it on.
And I think you can understand with all these different scenarios why it gets so confusing with people. Is this okay? Is this not okay? And that things are always changing. You know, the LA County Health Department is encouraging people who've had COVID-19 to still get vaccinated. But let's say you just had COVID last week. Should that person not get vaccinated right away?
Right. Actually, there is no minimum time period between when you have the COVID vaccination and when you recovered from your infection. The science tells us that in the first 3 months after recovering from COVID, you actually have high levels of antibodies, which keep you safe. And really, the risk for reinfection in the first 90 days is very, very low. So up to now, we've been telling folks, wait 90 days after your infection before you get vaccinated. But a part of that was also due to the fact that we didn't have vaccines available. Now the vaccines are more readily available. You can certainly get that. And we do recommend that individuals who have both symptomatic, asymptomatic infection, that they get vaccinated. But there may be an advantage to waiting. Some of the studies in Europe have actually shown that if you wait, you tend to have higher antibody titers after you receive your vaccination. This was actually shown in healthcare workers, in which they gave vaccination 1 to 2 months after their illness, 2 to 3 months after their illness, and greater than 3 months after their illness. And what they found is individuals who received the COVID vaccination greater than 3 months after contracting COVID, that they had the highest antibody titers. So there may be an advantage to waiting for the vaccine. On top of that, for individuals who've actually recovered from COVID and received either the monoclonal antibodies or the convalescent plasma, they should actually wait 90 days before they get the vaccination.
All right. That is excellent information. Dr. Leo Lee from Beverly Hospital, we appreciate it. Thank you so much.
Well, thank you for your time. Have a good weekend. Bye-bye.
You too.
You too.